Well, less than 2 weeks ago, my husband and I were in a waiting room while our son was having surgery. Now, it wasn't anything too serious. It was something, though, that I quickly learned happened to so many parents. He was having ear tubes put in. Dr. Blaize O'Brien with Ohio ENT and Allergy Physicians was the man to do it, and he joins me today to talk about this issue. So thanks for being here.
Good afternoon, Robin.
Okay, so first of all, I had no idea initially, even as a new parent, that this is a super common issue with kids.
It is the most common surgical procedure that's done in the world, and it's very common for children to get tubes.
Okay, and so how does someone know their child might be needing tubes?
Typically, it's because of recurrent ear infections, or if there is fluid that's persisting behind the eardrum and children can't hear because of that.
And it is because of their anatomy, technically, right?
Yeah, it's their eustachian tube isn't fully functional. That's the tube that connects your nose to the middle ear behind your eardrum. And so it doesn't drain that fluid correctly, and so you have a tendency to get fluid back there that becomes infected for the children.
And it is kind of, as some people kind of describe to me, it's almost like your kid he's hearing, but maybe hearing like they're underwater.
Yeah, it's
right?
like having water in your ear and you just can't hear completely clearly.
Okay, so onto the surgery itself. I'll show some pictures of my little patient just because he was so cute. He was riding around in like every stroller you guys had in the waiting room there. But it's such a simple surgery, as we said, but let's talk about how the kind of process works.
Yeah, so the procedure itself takes about 2 or 3 minutes, literally. Typically, it's just a gas anesthesia, so it doesn't require a tube down the throat or an IV in. And we give them a little gas anesthesia. We make a small little incision in the eardrum. We suction out any fluid that's there and put a tiny little tube. It's like the size of the tip of a pen, and put that in the eardrum. And then we put some eardrops in, do it on the other side, and we're done.
And I was saying, I literally walked into the waiting room, I brewed a cup of coffee, and I was kind of mad at you because I couldn't even take a sip of it yet before you came out and said, okay, he's all done, it went great.
Yeah, typically the parents are surprised how quickly it goes.
And I know one of the main concerns, as you mentioned, there is anesthesia involved, and just as any parent, that's kind of the main concern, I would say, going into it. So what do you say to parents to kind of calm their nerves?
Yeah, that it is very common, that it's extremely safe anesthetic. I mean, we're talking 1 in 100,000 chance of something bad going on. So very, very, very safe anesthesia.
And once they are done, what's the recovery process like?
So typically children will be a little bit irritable for an hour or two afterwards from the anesthetic and from making that incision in the eardrum. But usually they go home, take a nap, and by the afternoon, back to their normal self.
Yeah, I was saying he kind of was stumbling around a little bit, kind of groggy. They're not allowed to eat, obviously, prior to going in.
Correct.
That was probably his biggest issue as an almost
hungry
2-year-old.
Going in there.
Kids are hungry. So then, as far as the process afterwards, a couple of my questions that had been, and I think this is something a lot of parents ask, is dealing with swimming in water, especially when it's summer and you know your kid's going to be in there.
Yeah, so typically chlorinated water is fine. So once everything's healed, the tubes look good, there's no more infection, we'll let children swim. I tell parents to go ahead and let them swim in a chlorinated water. I'm a little bit more cautious if they go into lakes or oceans. I don't love dirty water getting in there. So in those cases, earplugs, swim caps are helpful. But generally, swimming pool, chlorinated water should be fine for the ear tubes.
Because they didn't always know that. I feel like back in the day, it was like, stay out, don't get water in it, that kind of thing. So it's changed.
It's changed over time. We've gotten to recognize that it's not as big of a deal to go swimming. And the recommendation right now is you don't have to do anything special for water precautions.
Okay, and 1 to 2 years, about the average for when they fall out?
Typically 1 to 2 years, the eardrum pushes them out over time and the ear tube just falls out with some wax.
Do they need another set typically, or how does that work?
Only about 15% of children that need one set of tubes will need a second set. So most children grow out of that propensity for the ear infections, and once the tubes fall out, their ears are healthy enough and developed enough that they're not getting the fluid or the infections anymore. And
I'll have to say that the benefits very much outweigh the risks. I think every parent I've talked to that has gone through this procedure has said that, not only for the lack of ear infections, but my son's talking like a crazy person now.
Yeah, well, if you haven't been able to hear and all of a sudden everything's very clear, the speech a lot of times develops very quickly after that.
Does it mean he'll listen better?
No, not at all.
O'Brien, come on. I told you it was supposed to be beneficial, right? No. But anyways, it is, just calm your fears if you are in that situation. Of course, you want to meet with an ENT, somebody who specializes in that.
Absolutely.
All right. Well, thank you so much for being here.
Thanks for having me.